I usually get the doTERRA mouthwash, 1 capful, because if he swallows it, it's not going to be bad for him. It's actually good for him. And then I get the doTERRA toothpaste, and I will go to the sink right now and get the toothbrush because it's usually on the sink. I put a little bit of toothpaste on it, which is good for him. Swallows it, it's not going to be bad for him.
How much is the toothpaste? How much? Okay, $1.
I usually do it. $1. I usually have the water bottle here for drinking, warm water to for the suction, and to rinse the toothbrush as I'm brushing his teeth. So this is how Mom does it. I usually take the flashlight and I put that on so I can see down his throat. I usually take the pillow off. Usually put his head down. And if his feet are up, I usually put that down. So he's pretty straight. And I usually, this here, it's very hard. Sometimes you have to kind of push it towards there and then pull it out. Then it goes down. I put this as close as I can to the bed. If you don't do it really fast, you'll start grabbing it. I put this underneath his head. And then I put it like this. And then I take his iPad and I put it right there. Then, a lot of nurses don't do it this way. I do it because he's used to it. I've been doing it since he's been a baby. So I coddle him so he can't grab anything. So his hands are like this. And so my knees will be probably right here so he can't grab it. And he's fine with it. He's used to it. So I go like this. See, and he'll try to do that. So you do it kind of right where his elbows are. So then he can't grab at you. He's used to the routine. And then I put the towel like that. Sometimes I lower it a little bit more so I can see down his throat, because if he gets, because it doesn't
So you want him almost flat.
Almost flat, yes. And then sometimes he'll start coughing like that because he knows we're going to be brushing his teeth, which is fine. It clears his throat. So I have the toothbrush here. Sometimes I give him a drink first. Lift up his head a little bit. Squirt a little tiny bit in his mouth so wet his whistle. Sometimes he has a lot of dried spit on his mouth, so I like to get that off. So, and then I start coughing. Cough, Marky. Cough, cough, cough. Cough, cough, cough. Good job. Good. I don't mind him doing that because it's clearing his throat. Okay. Oh, sometimes I put on now. Are you gonna cough anymore? Okay. Now I count because sometimes I count. He knows it's not going to last forever. I count to 5, then I count 5 again. And I put the water close to me like this. Towels right there. Sometimes I tap that a little bit to put so it's not so. Okay, Marky, I'm going to go up and count to 5, and you can just watch me. Okay. Okay, here we go. 1, 2, 3. I'm going to go away. And he likes the vibration, so he doesn't not like it. 1, 2, 3. I'll go down to the bottom. 1, 2, 3. 1, 2, 3. And I say tongue, tongue, tongue. Tongue, tongue, tongue. He'll stick out his tongue. You're saying tongue, tongue. And I try to get back to get his tongue nice and clean. Tongue, tongue, tongue. And then sometimes I go like that just to get that crust off. Sometimes I stop it. And get it wet a little bit. Wipe his mouth. Okay, sometimes I put more toothpaste on it, so I keep that. Just a little bit though. I'm going to start at the bottom of his teeth. And I hold at my thumb here. 1, 2, 3, 1, 2, 3, 1, 2, 3. And then I turn it upside down. 1, 2, 3, 1, 2, 3. And I kind of get this dry so I can go up on his. Whoops, sorry, Marky. See, and I try to get his teeth. 1, 2, 3. 1, 2, 3. He doesn't mind this.
It's more. It's about routine.
Yeah. Okay, and I'm gonna kind of rinse this. Turn this down a little bit. But come on. Sometimes I turn this off to do his tongue. Okay, tongue, 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 tongue. Way back there. Let's get that tongue. Get all that bacteria off. And then I'll give him a drink. 1, 2. I kind of lift up his head a little bit so he's not flat, so he doesn't go choke. 1, 2, 3, 4, 5. And sometimes this is when, if I do just give him a sponge bath, this is when I wash his face. When he's always like this, I have warm washcloth here. I wash his face, do his hair, do his ears,
So his teeth.
and all that. And his teeth.
Okay.
And then,
Start.
and after I brush his teeth, then I'll go back and section him. I don't go deep, I just go down. And so that's why I have this on, so I can see down his throat. And I'll show you how I hold his I usually go like this, and he'll open his mouth. I can look down there, and right on the side, a little tiny bit, because he's already coughed really good. And a little bit on the side, and that's usually my half right there. And then I take the same one, because he doesn't blow his nose, I'll just go in. That. And that. And then it's like blowing his nose. He can't blow his nose, so I blow it for him. After that, I will take one of these here, and I will put that in the toothbrush, the mouthwash. And he's ready for it. He's used to it. Tongue, tongue. And this is actually good for his throat. Good for inside his mouth, and it's good for him actually because it's the doTERRA On Guard. Okay.
Looks like he likes it.
And he likes it. He likes the taste of it, even though it's. So he's already had his drink. He's done that. So that's it.
Good job, Marky.
All right, Marky.